Hello, employees at Kerr Plumbing. My name is Ross Schamberger, and I'm the insurance agent that handles your benefits there at work. So, health insurance is what we're talking about today. So, January is your anniversary date, and we are changing carriers from Blue Cross over to what is now known as Scott and White Health Plans, formerly known as First Care. So if y'all been there for several years, y'all had First Care for a long time. They priced us out of the market. We switched over to Blue Cross. Now Blue Cross is doing some of the same thing. Their rates increased. So we're moving back to what used to be First Care. Scott and White bought First Care really 2 years ago, officially changing the name as of January 1 to Scott and White Health Plans, and their rates are very aggressive at this point. So we're going to take advantage of that and save you guys some money and give you actually a better network in many cases. So you should have a packet or already have seen the packet that we put together, and we brought it over to Danae. So if you have any questions, ask Danae, and then if you need to call me or Ashley here at our office, you're certainly welcome to. That number is 783-8959, 783-8959, here at the Schamberger Agency on 12215 Quaker. So y'all are welcome to come by. You've been here sometimes working on our plumbing. So you've got that. So what we're doing is changing to a very similar plan. Today you have a $3,000 deductible. We're switching that over to a $3,100 deductible. Obviously, because Scott and White doesn't offer a $3,000 deductible. But most of you there today are on an HMO, where you're limited to UMC, Lubbock Heart Hospital. With this plan with Scott and White, you'll go back to having Covenant as part of that. And part of their network now includes Baylor in Dallas and Austin, and then the Scott and White facilities down in Temple. Scott and White, that's where they've been for years. Very well known as being a place of excellent. They bought the Baylor system a couple years ago, so now it's known as Baylor Scott and White. They've got a lot of facilities in the Metroplex Dallas area and then over in Austin. So if you need the specialties down there, then you certainly can do it. It's in network, so just make sure you're using an in-network provider. Whatever you do, make sure you're using an in-network provider. If you go out of network, it's not covered. Okay? Now there's exceptions to that, but you have to get it approved in advance. But here in Lubbock, again, it's Covenant, it's Grace, it's UMC, it's the Lubbock Heart Hospital. It's most of the facilities. Does not include North Star Surgery Center, but because it's most of the facilities, you've got most of the doctors. So and we've got great care here, so they can probably do 99% of everything that's done. But every now and then there may be a specialist over in the Baylor area that we need to go to. So keep that in mind. So if y'all have questions, call us. So in the packet that you have is a summary of benefits and coverage, just telling you basically the benefit. What is your overall deductible? It's $3,100. If you carry your family, $6,200. So that could be two people meeting $3,100. That could be a combination of four people in your family accumulating $6,200. It'll never be more than $3,100 for any one individual, and never more than $6,200 applying to your deductible for a family. So theoretically, nobody met their $3,100, but when the family hits $6,200, that's when they stop. Once you've met that deductible, the plan is going to pay 70%. You pay 30%, generally speaking. Does have an $8,500 maximum out of pocket. Talks about preventive care there again. As long as you're going in for preventive care and your provider files it as preventive care, it should not cost you anything. It's free. Okay, that's part of the Affordable Care Act. If a doctor puts a diagnosis on it, now all of a sudden it's subject to your deductible. Okay, so just know that. When you flip the page, you go to see your primary care doctor. It's a $40 copayment for that office visit. Just like Blue Cross, that covers the cost of the office visit only. So if they do any lab or x-ray there, that is subject to your deductible. If you need to see a specialist, make sure you're staying in network, but you do not have to have a referral. Go see a specialist. You pay $80 for that specialist office visit. Okay, and again, that covers the office visit itself. If they were to do any lab or x-ray while you're there, that is subject to your deductible. Diagnostic tests are covered at 70% by the company. You pay 30% after your deductible. So I'm just going down the page. Imaging like CAT scans, PET scans, MRIs, subject to your deductible, paid at 70%, you pay 30%. When you get over into prescription drugs, Scott and White does have a preventive care benefit, so that you don't pay anything for those preventive care drugs. So then on tier 1, it's $15 copay for generic drugs. Tier 2 is preferred brand name drugs at $55. Tier 3 are non-preferred drugs at $150, and Tier 4 the specialty drugs at $500. So basically it's a 15, 55, 150, 500 copays on prescriptions. Hopefully none of you are over in the Tier 4. That's drugs that obviously if the copay is $500, the cost is considerably more than that. So again, if you guys ever have questions about what tier things fall in, we will send Danae a list of the formulary, so y'all can check it there, but you're welcome to call here and we'll check it for you. If you go to the emergency room, $750 copay. Now keep in mind, every time you get a prescription, every time you get a copay, if you were to go to the emergency room, that $750, it does track over toward that $8,500 maximum out of pocket. So your deductible of $3,100 tracks that way. Okay? So it all accumulates so that you should never be out of pocket as long as you stay in network more than $8,500 on any one person. So they're just trying to tell people stay out of the emergency room. We continue to have a lot of folks go to the emergency room because they have the flu or strep throat or something like that. If it's a true emergency, sure, go. If you're not sure, maybe sure, go, okay? But if you're just not sure you got the flu or whatever, use one of these clinics. We are blessed to have clinics in Lubbock that are open 7 days a week. Do not go to the freestanding ER facilities, okay, because it's going to cost you $750, and a couple of those are not in network. Now, Covenant owns a couple of those. Star ER over on the Loop probably is in network, but some of these other places that are like 50th and Quaker may not be in network. So don't stop at them, and it'll cost you $750. But you know, if you are having an emergency, if you're having a stroke, you can stop at one of those. They can do nearly everything in there that they can do at the main hospital, okay? So it is a true ER, and I don't know, for me personally, I would probably stop at Star ER instead of trying to make it all the way down to Covenant if I thought I was having a stroke or a heart attack, okay? So as you go on down, urgent care, $80 copay. There's some facilities around town that are designated as urgent care. A lot of times you think they're just the regular freestanding clinics, but some of them are actually urgent care centers, so it costs you $80 there. Again, facility fee, where if you're going into the hospital, doctors, once you've met that deductible, it's paid you pay 30% and they'll pay 70%. So then if you just go right on down for mental health services, of course, if you have an office visit, there's a $40 copay. If you're inpatient there, then it's 70-30, just like always. For somebody that's pregnant, that first office visit is going to be a $40 copay, and then the actual childbirth is subject to your deductible, paid at $3,000 deductible, and then at 70-30. So then when we flip our page, again, you can see they just continue with things being 30% after your deductible. So rehab services does have a copay, a $40 copay, and then deductible does apply. Skilled nursing is 30% after your deductible. Durable medical equipment, which can be like a hospital bed, it's going to be crutches, that type of thing, 30% after deductible. Hospice care is 30% after deductible. And then there's children's eye exams and glasses with an $80 copay. If you get into that and kids need glasses, call us and let us make sure you're going to the right place. It is limited to one eye exam in a plan year and one pair of glasses in a plan year. So basically that's the plan, really similar to what you have. A few little changes there. So that'll help a lot. So right behind that you're going to find a flyer. This is a little different, MD Live. With Blue Cross, if you called MD Live, because they use the same company, you had to pay a copay. All right, so if you called them today, you had to pay an office visit copay. With Scott and White Health Plans, it's free. Okay, you can call 7 days a week, 365 days a year, anytime from anywhere. So Christmas Eve, 3 a.m. in the morning, you wake up with 103-degree temp, you got a horrible sore throat, you think you maybe have strep throat because somebody at the office had it, whatever, you can call a doctor at 3 a.m., they call you in a prescription. Lubbock's got, to my knowledge, 2 pharmacies that are open 24 hours a day, so you need to have that phone number looked up in advance so you can give that to them. So let me give you a little advice. First time you call MD Live, they're going to want you to fill out some information just like a doctor's office does the first time you go in. They want to know everything about you, your health history, what prescriptions you take, what surgeries you've had. So it takes a little bit of time to fill out all that stuff that's basically on the clipboard that you get when you go to the doctor. Okay, they just want to do it online. That way when the doctor goes to prescribe you something, they won't hopefully give you something you're allergic to. Okay, so go ahead and do that while you're feeling good. You can go online or call and do that, get it done, and then when you do actually call 6 months, 9 months down the road, you don't have to take 10 minutes when you feel like heck, to fill out all that stuff. So you can go ahead and do it today. They'll screen your call. They'll say, oh, I see that you've already created an account, answered the questions. Has anything changed? Hopefully you'll be able to say, no, everything's the same. And then they'll say, then why are you calling? They'll screen your call and see if it's appropriate for a doctor to help you. If it's an emergency, of course, they're going to tell you to hang up and call 911. But in that case, assuming everything goes good, they'll take it most of the time, nearly all the time, it fits them. They tell you hang up, a doctor will call you back. That call can be 2 minutes away or 15 minutes away, just depending on how busy they are. But it's going to be a real doctor. It's not a physician assistant. It's not a nurse practitioner. It's a real doctor that's right here in the United States that you can understand. And they will call you and say, hey, what's up? And you give them all the information. So that's on there, and that's really good to have. I'm excited about that because it's free, okay? And there's nothing better than free, all right? So y'all utilize that. It'll save your plan. It'll keep you from having to go to the doctor and wait to see a doctor. Just everything about it I think is good. We have it here at our office. I've used it numerous times, and I've been very pleased with it. Right behind that are the rates that you will see. If you want to know what it's going to cost to add a dependent, you can do that. Find their age, and there's the rate. So it is open enrollment. So if you want to add somebody to the plan that's not covered today, you can do it, okay, effective January 1. Pre-existing conditions are covered immediately, so you don't have to worry about that. All right, so you got to get them in. You just can't walk in 6 months from now and say, hey, today I've decided I want to add my spouse. She's going to ask you why. If there's no what we call special enrollment event that's happened, she's going to say, I'm sorry, you have to wait till January of next year. So right now is that time to put people on, no questions asked. So if you want to add a spouse, find her age or his age, and there's the rate. If you want to add kids, they don't charge for more than 3 kids. So if you have number 4, 5, 6, or 7, then they're going to charge you for the oldest 3. Okay, but they will not charge you for the 4th, 5th, 6th, that kind of thing. So the rates are right there. Those are good till next year. Then behind that is your enrollment form. We need every one of you to complete this enrollment form. Even if you don't want the coverage, you need to complete this enrollment form. Okay, so there's a place on there for you to decline the coverage. It's on the second page. If you're enrolling but you're not going to sign your spouse up or your eligible kids, and again, eligible kids are all kids under age 26. If you're not going to cover them on the plan, you need to decline coverage on your eligible dependents. That's the second little box to hit there. So if you would, make sure and do that. Let Danae look at that. If you're going to cover dependents, you need to list them over here on page 3. Then you flip it over on the back and you sign and get this turned in. And then behind that, it's really just some notices that employers are supposed to give you. So there's a HIPAA notice. There are notices in here for the health insurance exchange. Of course, that's where you buy your own policy. and possibly get a subsidy. Little word of wisdom here, since you're working at a place that furnishes you with health insurance, you're not eligible for a subsidy, nor are your dependents, okay? If you work someplace that offers health insurance, you're not eligible for a subsidy. Notice of Patient Protections, Women's Health and Cancer Rights Act. Y'all give us a little look over. CHIP notice, that's Children's Health Insurance Plan, which has nothing to do with your group, but people that have a lower income can qualify for that and pay a very, very reduced amount of money for their kids to be covered. Okay, so and kids that even though you are offered coverage at work, you may still qualify for CHIP. Newborns and mothers protection, and then here's a privacy notice at the end. So y'all read through that. Nothing says the employer's supposed to hold your hand and watch you read it or anything. So you never know. Danae may throw a pop quiz on you some morning just to see if you seem to be familiar with it. So that's the health plan. Again, we're changing from Blue Cross coverage over to Scott and White health plans. So right behind that, you will find the dental plan that y'all have that's emeritus. Nothing's changing on that. The benefits are exactly the same. The rates are exactly the same. Nothing has changed on that. They still have it, the name on there is First Care Dental Plans. That was an arrangement set up back when it was under First Care. So, but again, benefits are exactly the same. Rates are right there in the middle, exactly the same. If you want to enroll somebody on the plan, or you want to get enrolled on the plan, you can do that effective January 1. It does have a little $200 eye care benefit, so they call this fusion plan. So they've fused a dental plan to an eye plan, and it basically it pays you $200. You go anywhere you want to and spend up to $200, and that's the maximum it'll reimburse you. All right, so that's easy to keep up with. There's no deductible on that. Just get your receipts, and we can get you reimbursed on that. So rest of that is just what it says. It pays 100%. There is a $50 deductible for certain things on type 2, type 3, but if you're just going in to have your teeth cleaned, there is no deductible on that plan. But again, that's the same plan we've had in there for several years, and it did not change. If you want to enroll or add dependents, there's an enrollment form for you in the package. But if you're not changing anything on the dental side of it, let's say you're on it, you don't want to change it, want to keep it like it is, then you do not have to complete this form again, okay? So you can make a paper airplane out of it and throw it across the table there at Rusty in your morning meeting. So other than that, that's really about it. It's pretty simple, but if you have questions, give us a call here, 783-8959. Ask for me, Ross, or for Ashley. She's probably the easier one to get a hold of. But anyway, do that, and then we just look forward to you staying healthy. Hope you are, and thank you again for watching this video.